Chest radiograph is one of the most common radiographic procedures. Even student radiographers typically begin their clinical experience taking chest radiographs. But before beginning your clinical experience, it is important to learn and understand the chest anatomy and also the relative relationships of all anatomy between the chest cavity. Now, the chest or the thorax is the upper portion of the trunk between the neck and the abdomen. Radiographic anatomy of the chest is divided into three sections: the bony thorax, the respiratory system, and the mediastinum. And in this video, we're going to look at the bony thorax. So let's get started. Now, the bony thorax is part of the skeletal systems that provide protective framework for the parts of the chest involved in breathing and blood circulation. For breathing, we have the lungs, and for blood circulation, we have the heart and the great vessels located between the bony thorax. Now, there is also a term you have to note, which is the thoracic viscera. The thoracic viscera is a term used to describe the part of the chest containing the lungs and the remaining thoracic organs contained in the mediastinum. Now, anteriorly, the bony thorax consists of the sternum, which is the breastbone, and this sternum is divided into three parts: the superior part, which is called the menumbrum, the large center portion, which is the body, and then the smaller inferior portion, which is called the xiphoid process. Superiorly, the bony thorax consists of two clavicles, which are also called collarbones. Now, these clavicles connect to the two scapula, which are also called the shoulder blades. Now again, it has 12 pairs of ribs that circles the thorax, and it also has the 12 thoracic vertebrae posteriorly. Now, for accurate and consistent radiographic positioning, the radiographer or the technologist is required to master certain landmarks or reference points that can be used to center the image receptor correctly to ensure that all essential anatomical structures are included in a specific projection. Now, these topographic landmarks should be part of the body that are easily and consistently located on every patient. So for chest X-ray, the two topographic landmarks are the vertebral prominence and the jugular notch. Now, for the vertebral prominence is an important landmark for determining the centering point or the center ray location for PA chest X-ray, that is posterior anterior chest X-ray. Now, this vertebral prominence is kind of easy to find in every patient. You just have to run your hand or your fingertips with a little pressure down the base of the neck of the patient. Then you have to tell the patient to bend the neck a bit forward. So when the neck is dropped a bit forward, you run your hand down to the base of the neck of the patient. It is the first prominence you are going to feel there. I can literally palpate my own now. So it's easy to detect this anatomical landmark, and it's going to help in centering the central ray during chest X-rays. Another anatomical landmark or topographic positioning landmark is the jugular notch, also called the menumbria or the suprasternal notch. The jugular notch is an important landmark for determining the chest X-ray placement for anterior-posterior chest projection. Now, this jugular notch can be easily palpated. It's just that deep notch or depression on the superior portion of the sternum below the thyroid cartilage. Now, the mid-thorax at the level of the T7, which is the 7th thoracic vertebrae, is located easily using these two landmarks, which is the vertebral prominence and the jugular notch. So, these are the topographic positioning landmarks, and this is the anatomy of the bony thorax found in the chest. In another video, we are going to talk about the respiratory system and then the mediastinum. We are going to talk about the organs found in the mediastinum. Until next time, bye.